Hi, and welcome back to the NextGen HealthTech Podcast, where we sit down with thinkers, builders, and doers redefining what healthcare looks like in the real world. We don't do buzzwords, we do what's actually working on the ground. Joining us today is Leigh Wager, and just a quick note here, if you haven't liked or subscribed on the channels, please feel free to support us for the next videos upcoming in the next weeks and months. So Leigh Wager, she's an advisor at Moneta Health and also Exer AI. She will tell us more about this in a moment. So let's kick it off. So Leigh, can you tell us what drew you to advising companies like Moneta Health and Exer AI? I think that would be a great starting point.
Yeah, absolutely. So yeah, before working with these companies, I spent 10 years at a company in the physical therapy, occupational therapy, speech therapy space. And both of these companies are actually kind of adjacent to that previous opportunity. But I spent 10 years growing a company called MedBridge. We worked with physical therapists. We worked on musculoskeletal care. We also provided education. So we worked with the patient side as well as the provider side. And, great company, successful company. But what really drew me to these other companies and starting to work with them was trying to look at what are the different ways that you can work with providers and health systems and trying to get some exposure and experience in just different ways of engaging with the providers, different business models, different problems to solve. So Moneta Health is a speech therapy practice, a virtual speech therapy practice that focuses specifically on cognition. So they work with a lot of patients that have dementia, Alzheimer's, other neurologic conditions that impact your cognitive ability, traumatic brain injury, stroke. We've had a couple chemo patients, we've had a couple long COVID patients. Really, it's a really kind of interesting model because it's a virtual practice grounded in therapy, but solving a different problem. And it's a practice that operates as an outpatient practice. So bills insurance directly, works as a referral partner for providers, sometimes under professional service agreements, sometimes, even direct to consumer, though you do need to facilitate a referral there, and really solves a really specific capacity problem, which has been fun to tackle. So that's kind of one side. It's a emerging type of rehab. It's not new by any means, but it does require a lot of frequency and lots of touch points for it to be successful. And that's where the virtual piece has really kind of unlocked some of the capacity and travel restraints that that patients have too to get the frequency that they need. Then flipping over to Exer. Exer's on the other side. Moneta is kind of more services, more of a practice. Exer is not. It is very much a technology company that uses computer vision to track motion. So I first was familiar with them on the musculoskeletal side, but they've kind of evolved a ton over the last few years and have gotten really deep on just overall movement disorders. So whether it's musculoskeletal, gait, neurology, hand, and they work with different providers to help them quantify, capture data in a more accurate perspective. They plug into the workflows, so they've found the right billing codes that support what they do. So that makes it valuable and beneficial for the providers as well. And then from there, they help present the data back to the provider so they can kind of get the more accurate but also longitudinal data over time, which is really challenging for them to get to with a high level of accuracy and reliability.
It sounds interesting on both sides.
Both
Absolutely.
Great companies, great
Both
teams.
Great companies. Yeah, absolutely. And in terms of the products, because you have an expertise in product placement, how are you helping them stand out in such a saturated space? I mean, digital healthcare it's an emerging topic nowadays, and it's really driving the market. So how are you helping them, navigate through this very densely saturated space at the moment?
Yeah, that's a great question. So I think when thinking about digital healthcare, and to your point, kind of a saturated market, there's really what I've seen kind of two categories of digital health tools. There's the digital health tools that focus on the employers and the health plans that are very much cost savings. You're looking at how do we reduce utilization? How do we reduce spend? Focusing a little bit more on the preventative, very digital first. So that's one world. These two companies are not that. These two companies are working with the health systems and the providers. And there are elements that focus on outcomes and quality and cost savings over time and trying to reduce barriers to care, access, et cetera. But they're plugging into a system that is still primarily driven in a fee-for-service market. So you're still looking at productivity. You're still looking at billable services and billable rates. You're still looking at that financial piece, and cost savings can oftentimes actually conflict with what the health system's revenue goals are. They have to stay in business. It's unfortunate. I wish you could say everything's value-based. Well, I don't know about that. But generally speaking, the fact that you still have to bill for services, it's just how they deliver care today. And so that, I think, understanding which world you live in is really important. And then from there, helping to identify where are you solving those gaps in the world that you live in. So both of these companies live in a world where they're working with providers. They're working in a fee-for-service environment. Yes, there's absolutely applications for both of them to be valuable in a value-based care environment as well, but the market isn't there yet for them yet. And the companies need a little bit of evolution to get there and kind of prove out with, more time to build those relationships. So that is one of the pieces, is just defining where do you live and where don't you live? What type of value prop are you going to be working on? And how are the providers going to use it? By being able to know that, you can help differentiate. So that's one piece. I think the other piece on the differentiation front with Moneta specifically, they're very much in a category creation motion. It's not that there's tons of competitors out there doing cognitive rehab virtually. There's not. There's a couple app-based programs, and oftentimes Moneta gets confused with some of the brain games and the cognitive training, which is different than cognitive rehabilitation. So that's one piece of it, is identifying, okay, we're in a category creation motion, not necessarily a direct competitor motion. So there's a lot of market education that has to go on. We spend a lot of time working with primary care providers and neurologists saying, this is what cognitive rehab is. It's speech therapy. You could refer to this in person. However, typically your in-network speech, your kind of in-system speech therapists just don't have the capacity to see patients 2, 3, 4, 5 times a week. Doing a telephone-based program, you can. So that's a big piece of it, and continuously showing the evidence and the outcomes and what's going to help keep the providers going, and how do you integrate into that workflow. So that's, on the Moneta side, it's really working through that kind of education and awareness side. On the Exer piece, their team they have a phenomenal technical team. They've got great relationships with the providers where they're doing the clinical research and the trials, and they're building out the validation to have a lot of the data that supports what they do. So they work through it. Can we see it? Now that we see it, is it accurate? Is it better than a provider? And what do you do with that information? And so with them, a lot of my work with that team is focused on what do you do with that information? Great. Technically, we have it all, but so what? Who cares? Why is this valuable? And so in there, we really focus on the value piece and how do people use it to make it a little bit more effective and efficient.
Maybe as a next question, you mentioned regarding healthcare providers, and what came to my mind as a question here was, what challenges do they usually face when adopting such tools as Moneta Health, for example?
Yeah, absolutely. There's a few things that come to mind with some of the adoption challenges. The first is workflow. It has to be easy for them. They don't want to, you hear about clicks and making sure there's fewer clicks, but even more so than that, the providers have to do a lot of things when they're working with a patient. They're taking notes on a lot of things. They've got to remember a lot. There's just a lot going on in their head, and it has to be really easy for them to connect the dots. So a few things that we've seen is, really working into specific workflows. So some examples, we have one practice that we're working on plugging into their intake form. So a patient comes in to check in at the front desk. They fill out their information on a tablet. This partner uses Phreesia for this. And they fill out their information. Sometimes they collect some other surveys. It might be a depression survey or, a general kind of wellness survey that goes on. And then we also are working on putting in a kind of partnership page of saying, hey, this company has partnered with Moneta to provide cognitive rehabilitation. Is this something you're interested in? And so it gives the patient the ability to say, yes, I want this. I want to learn more. I want to talk to my provider, or no, this really isn't for me. It's not something I'd even be interested in. And that way it's automatically into the workflow. So the provider doesn't have to think about it. It's already happening. And then when the patient goes to see their provider in the next 2 to 15 minutes, depending on how long they're waiting in the waiting room, it reminds the provider that this is what the patient said to this form. So then it's top of mind for the provider as well. And if they said yes, they're like, great, enjoy, good luck. We don't have to talk. Usually they will talk to them about it, but they don't have to. And then if they have questions about it, they can have those questions. That does mean on the Moneta side, we have to spend a lot of time, not a lot of time, but we have to be intentional about working with the providers so they feel confident talking about what is Moneta, what what is cognitive rehab? Why are they referring it? What can the patient expect? So that's the second barrier that I've seen across all of these platforms. If the provider is recommending something that their patient's going to do, they have to feel confident in what that patient experience is going to be like. If they don't know, they're going to say, okay, try this thing. And then the patient asks them a question like, oh, how long is it? Or what should I expect? Or what will I do with them? If they can't answer that question, they don't want to give it to they don't want to get that patient. So they're not going to refer it to the patient. So those are kind of two of the main challenges is, workflow and making it easy for the provider to remember it. And then making sure the provider has confidence in being able to talk about it with their patient.
So basically educating the providers plays a huge role here.
Yes.
Right.
Exactly.
What about, speed is a big thing nowadays, and how fast you get things done, especially with AI. How do you balance speed to market with like the rigors of evidence and clinical trust? This is maybe an interesting question.
Yeah, absolutely. And this is something, with both Moneta and Exer, I have been blown away at how much research and validation that they have done for how early stage company they are. Both companies spent those early days, instead of just trying to build a solution, they went in and said, how do we partner with the providers that are facing these challenges and build something out with them that's validated and backed by research? And it's a slower time to market. They both had some funding to kind of help support that, and also found funding that covered. So Moneta, for example, was able to get some grants through the NIH and through some AI incubators to be able to pay for some of those first patients. And then they also partnered with a health system that was, if they didn't accept the Medicare insurance, then they were able to get coverage for the cost, a portion of what Medicare would pay as well. So they figured out ways to get their costs covered while going through that validation stage. Similarly with Exer, they kind of had some partnerships where they're able to kind of use an existing product and then partner with them to build out the research for the next phases. And with both of these organizations, they're working with, top named institutes, whether it's, Duke or Cleveland Clinic or Mayo Clinic, and they're really spending the time to go through that research and the validation. And that's really helpful to get the buy-in. I think in the kind of life cycle of these types of products, you're going to find a few champions on the clinical side that are really excited about this. They're like, yes, I want to do this. They may be your kind of like, they're either kind of entrepreneurial, even though they're in healthcare, or they're just a little kind of like techie and nerdy and want their hands in things. And you're going to find those people that are going to say, yes, I'll work with you on this. We'll do this. We'll get the data. Works. We'll publish it. They want to publish it. They want to do the research. Those are your early partners that you want to find that can help you get the momentum going. So then when you get to the bigger systems or the bigger providers that are like, I don't do research, I treat patients. I don't want to do that with you. I want to trust that it's done, and I need the results for you to show me that this is going to work and it's effective. So you have to go through that cycle with your early partners to get to the trust and credibility that you can bring to market at a bigger scale.
Yeah, that makes complete sense. I think because Exer AI is a really interesting company from my perspective. It handles something, a very niche topic that's not talked about enough. Can you walk us through what makes the motion analysis different there? How does it differentiate?
Gosh, I wish I could give you all of the ins and outs of it, but I can't. I'm not the technical person. I will defer to them to do that. But I think some of the parts that are unique is instead of looking at kind of some of the broader motion capture elements, they've gotten really specific use cases. And so the hand is one that's really interesting. Like there's so many movements of your hand, and now when I talk about the hand, you see me go woo and move my hand everywhere. And so as they were going through it, kind of their process is to say, okay, first of all, like where is there a challenge? Where do the providers need data? And so for Exer, they actually started working with Parkinson's patients and quantifying a tremor because there was a new technology coming out to help reduce tremors. And what they wanted to be able to track was like, is this working? And how do we quantify? It's like the Parkinson's tremors, oftentimes you have the piece of paper and you have them draw lines and draw letters, and you see, is it it's kind of a subjective, like, I mean, it's not entirely subjective, but you're looking at this and saying, how do you do this? And there was no way to quantify what is, what type of tremor, what's the frequency of the tremor, does it change? And so they found kind of the right opportunity to say there's this new technology to do a non-invasive procedure to reduce the tremor. And therefore, can we measure that it's accurate, and can we measure that it's going to sustain those changes over time? So that, I think, is a different approach than a lot of other ways of doing this. On the actual technology front, I'm going to defer to the expert on how to answer that. I'm sure I could look it
Leave
up.
the tech to the tech guys. Yeah.
I have it in my head at the moment.
So from the way I understand it, this is a technology that could be widely used in rehab centers, for example. What about maybe just as a thought that came to mind, this is something that could also really be integrated somehow into sports medicine, because you have a lot of movement there. Some types of, some athletes have specific types of injuries which prevent them from having these specific movements, or could that be applied in that direction as well? For example, like sports science or trauma injuries overall?
Yeah, absolutely. I mean, it absolutely could. I think with the sports medicine, it's finding, where's the need, who's excited about it, what's the application for it, and how are you using it? And with Exer, they've had a lot of success in orthopedics, neurology, and hand and wrist is kind of like, and then primary care as well, and kind of doing the basic assessment in primary care to be able to pass that information to the specialist. So there's a tremor, I'm not sure what it is, let's do this assessment, and that can help you get into the right specialist route. So absolutely, it could be used in sports medicine too. It's just finding the right kind of champion use case, and also the right billing mechanisms to support it as well. I think that can be a challenge sometimes in sports medicine, is finding the right financial model to make it work.
Absolutely, yeah. And we have these great products, right? So we have a lot of startups nowadays in digital healthcare. Some, they go to the market, they do really well. Others don't. It's a matter of kind of, I think, fitting well, having the right technology, having the right buyer persona, the ideal customer profile. But in your opinion, what is the mistake that maybe startups in digital healthcare need to avoid, or usually what types of mistakes do they get trapped in when trying to sell into these healthcare providers and sell their products and services?
Oh, yeah, great questions. I think especially when you're working with healthcare providers, I mentioned the business model aspect, and that's really important. There's a ton of great technology out there that you can't struggle to fit into. Is there a budget, or how are we going to pay for that? And that can be a huge challenge. And you could have, it could provide the best results and patients love it and it's amazing. But if the patient's not going to pay for it, and you can't figure out how to make budget for it because it's not impacting something that can move the needle on the financial side for the system, that is a big challenge. So that's a big area. You can go really far without figuring out what the right financial and commercial structure is. That can be really challenging. I think a second piece, we talked about the data and the outcomes and the results. I think it's really important, especially in the early stage companies, to be able to deliver results and value consistently to the client. And if you're burning those bridges and relationships early on and not fixing it, then it's going to be really hard to scale that over time. So really, really over delivering on those first customers and finding the right customers that are willing to partner with you on that. I think that's an important early stage consideration. Is there's going to be some customers who, I think back to one of my previous companies, and we had a customer that kind of raised their hand and said, we do not want to be your beta customer. We do not want a beta product. We do not want to be a beta customer. That is not what we want. We don't have the capacity for that. We don't have the structure for that. We want a full-baked, full-fledged, tested, we are not your beta customers. And fast forward, and we're like, here, we have this product. It's an MVP. And we tried to give it to them, and they don't want to give feedback. They're not happy. They're frustrated. And they're not going to use the product in that form because that's not who they are, and they're not the right type of partner for that. And so being really clear on what type of customer do you need? How developed is your product? And are you ready to go to those non-feedback partnership clients yet. So I think that's really important. And then I think the final piece is in those stages and you're getting feedback from customers, your customer sample size, unfortunately, is small in the early days, right? You're going to have, let's say, 3 to 10 of your first customers. And it's easy to respond to each customer individually, accidentally. It's also easy to assume that they're all asking for the same thing. And I think being able to figure out where are the similarities, where are they asking for the same thing, and where are they asking for different things, and then what traits make them similar and different is really, really important in those early stages. And that can be startup or that can be launching a new product on top of an existing business. You see a lot of businesses that kind of get to a certain size and they're like, great, we did this. Now we need something new to continue to grow. And maybe that's a new product to your existing customers. Maybe that's going into a new market, but you're still going through the same cycle and same iterations there of saying, okay, we have, as an example, at one of my previous companies, we had probably 7 customers that were raising their hand saying, hey, we have this problem. We want this thing. And at first we were like, cool, this is great. Everybody wants it. And then you start to dig into it and you go, ooh, actually, you're all asking for similar things, but a little bit different. Like, where are the similarities? What are the customer segments that we feel confident we can serve? And how do we build a product that solves that problem and isn't trying to solve everyone's problem at the same time? Instead, let's start here. And then we can talk about the iteration and the roadmap and the evolution to solve these other problems too. But without being really smart about that process, you can accidentally build something that doesn't meet anybody's needs because you're trying to do everything for everybody all at once.
Absolutely, yeah. And those pivots are sometimes a hit or miss, and you need to analyze well before making a decision and making a move. And in terms of when we're speaking about these types of challenges and things that we need to keep an eye on, I think regulation is also a big thing, and compliance at the moment, especially with AI. How is this related to what you do over at those 2 organizations? I'm guessing it's also a hard time handling that topic as well.
Yeah, it is. I mean, I think across the board, where with both of these companies is trying to be really open and transparent of where you're using what types of technology for what. And then there's an integrity piece as well of like, let's make sure that we're looking at things from a quality and a privacy and security standpoint and make sure that we have the right foundations in place there. In some areas, there's not a lot of regulation. Moneta, for example, we kind of have an AI component on our voice exercises. Part of what makes Moneta unique is we're combining this telephone-based speech therapy so we can reach patients in rural areas. We can reach patients that have limited connectivity, no internet issues, no video issues, things don't go out. We can reach patients that can't travel in. We work with a lot of patients in Montana and, they have to drive really far to come in. So coming in consistently is hard. But then if you do it over the phone, we combine that with this kind of AI voice platform that calls the patients in between their visits to do their exercises. So then you have super high compliance because you're doing the exercises with the voice platform, but we're also recording it. And so we're able to look at changes, we're able to look at accuracy, and then we can summarize that for the provider. So you're also getting more informed live sessions based on what's been done before. All of that is great. However, we're now working in rural areas saying we've got this AI voice platform, like that does not go over well. And so we're very transparent in terms of what we're using AI for, how we're using it, how it's interacting with patients. Like in that scenario, it's recording it, but the patient is having the voice recording it. It's not an AI interaction with the patient. So there's an element there of just how do we talk about it and how do we make sure that we're comfortable and our providers and partners are comfortable and we're hitting whatever regulations are available at that point in time.
Yeah, really, absolutely agree with that point. And maybe here one more interesting question that I think it's also a topic that not a lot of companies are talking enough about, but I think how do you view the topic of research when finding, for example, the perfect health providers, regions where you want to further expand the product in? How much of a role does business and market intelligence play in those decisions when trying to move or expand?
I want to say a lot, and to an extent, it is a lot. There is an element of, again, if you're talking about an early stage company versus a more established company that has more resources and more introductions. So if you're at an early stage company, the research is really important to figure out. Like at Moneta, for example, we actually started in Florida because we're focusing on cognition and dementia. We're like, Florida's got a ton of over 65, like this is great. But what we found was Florida also has a ton of healthcare resources. There's specialists everywhere because they know that population. And so for us, being a telephone-based company, we were more valuable in areas where you didn't have specialists. And so that started to go into some of our research. We also just signed a great contract with TRICARE. So we're able to start treating a lot of the military and retired military population. And very similarly, there we're focusing more on TBI than stroke. But similarly, focusing on the areas where you have active duty on base, they have the resources and support there, and they're trying to encourage people to go to those situations. And so for us, that's not ideal. However, as you're retired and you're transitioning from somewhere where you have resources to Montana, for example, or Eastern Washington, where there's a high portion of former military population, that is a great area for us because we have the insurance coverage, but we're also able to serve those patients that don't have the in-person resources that they used to have before. So from that perspective, the research is really important to understand what's the patient population, how many other specialists are there. We call them neurology deserts when you don't have a lot of neurologists and you've got 4, 6, 9-month wait list and people are coming in to travel. That's a great market for us. So that's really helpful. And at the same time, introductions are key when you're early. Like once you're a more established company, you can rely more on the research and your own name and credibility and relationships. When you're an earlier company, you don't have that. So you also have to be opportunistic on which advisors and investors can give you which introductions and which partners and former colleagues love what you're doing and want to support you and move you on. So that plays, I think, it's always important, but it's more important in the early stages.
Absolutely. So yes, research is important,
Both.
I'm guessing. Great. And maybe here as a closer, how do you view this field transforming in the next 5 to 10 years? What is your personal opinion? Where is digital healthcare going? Or what are you most excited about?
Great questions. For me, I've always really enjoyed focusing on areas where you can kind of a couple areas, like focusing on where it's easier for patients to access healthcare. Like that's something that I think is really valuable. And it doesn't matter what type of payment environment you're in, like you want it to be easy to navigate and easy for patients to get the care that they need. So I think that's an area where I think we'll see more changes happening there in terms of navigating what's available and making that easy, like more transparent, easier for patients to find what they're looking for by being able to, simplify searches and aggregate, providers and what's covered and where are things. I think there's some interesting changes there. I think the second piece that's really interesting to me is based on what patients need and all the options out there, how do we make it easier to simplify and summarize what's helpful on the provider front? I'm like, how do we make it easier for providers to be able to refer to the right specialist or the right digital health program or, whatever's next there, or just manage it themselves? Like, how do we make that more, just easier to do? In the cognition world, there's a lot of movement on pushing things more into primary care, which is great. And at the same time, you're then asking primary care to become a specialist on all of these other areas. And you see that across the board and a lot of just in general, you see primary care has to do a ton. And so how can we use some of the technology that's out there combined with these great digital health tools that are emerging to pull that together and just make it easier for them to find what's necessary and what's important? So I think that with some of the AI technology and kind of like summarizing and making things more top of mind and easier to find, and also simplifying some of those workflows too, and like just being able to say like, hey, I want to do this. Cool, it happened. There's a lot of really cool companies working on documentation and scribe and pulling unstructured data and making that helpful and trying to reduce notifications and make them smarter. I think all of that's really valuable and really focusing on, again, simplifying the noise and like all of the things that have to happen to make it just easier for everyone.
That's one of the best answers we've gotten to that question, by the way. I really like it.
Glad I could support.
Great, Leo. It was a pleasure to have you. Hopefully, we'll do another episode down the line on some big
Perfect.
updates from you and the two companies that you're handling. It was really a pleasure. Thank you for the time. Thank you for everyone for listening in and watching, and hopefully see you soon again.
Awesome. Thank you.
Thanks. Bye.